Is C-section recovery different for subsequent pregnancies? Have you ever wondered how recovery after a C-section might change with each pregnancy? It is a great question, and one that many mothers consider. Recovery after a C-section can indeed differ with each subsequent pregnancy. This is mainly due to the scar tissue that builds up from previous surgeries and the potential risks that come with it. First, let's remember that a C-section is major abdominal surgery. After the first C-section, recovery typically involves managing pain, healing the incision, and gradually getting back to normal activities. This process can take several weeks. However, with later pregnancies, the presence of scar tissue can complicate things. This scar tissue can make the surgery more complex, leading to longer operation times and a more challenging recovery. Another key point is that the risk of complications increases with each C-section. These complications can include heavier bleeding, infections, and issues related to the placenta. One serious condition is placenta accreta, where the placenta attaches too deeply near the scar. This can cause significant bleeding during delivery. Because of this, doctors often monitor the placement of the placenta closely in pregnancies following a C-section. From a recovery perspective, women who have repeat C-sections might experience more discomfort or a longer healing period. The buildup of scar tissue can also affect future pregnancies. Sometimes, healthcare providers recommend planned repeat C-sections instead of attempting a vaginal birth after cesarean. Now, let's talk about vaginal birth after cesarean, often referred to as VBAC. Many women can safely consider VBAC after one or even multiple C-sections. Choosing VBAC can lead to a quicker recovery and a shorter hospital stay compared to repeat C-sections. However, it does carry some risks, like uterine rupture, which must be carefully evaluated by your healthcare provider. Timing between pregnancies is also important. It is generally advised to wait at least 6 months after a C-section before trying to conceive again. This waiting period allows the uterus to heal properly. Shorter intervals may increase the risk of complications and affect recovery. As a millennial mother balancing family, work, and self-care, understanding these factors is essential for planning pregnancies and recovery. Preparing for potentially longer healing times, managing pain effectively, and arranging support at home can help make recovery smoother. Discussing your birth plans thoroughly with your doctor, including the possibility of VBAC versus repeat C-section, helps set realistic expectations and reduce anxiety. While the basic recovery steps after a C-section ranges similar, subsequent pregnancies often involve more complexity due to scar tissue and increased risks. Planning ahead, close medical monitoring, and tailored self-care are important for navigating recovery as a millennial mother.